Hi guys, Nigel Farage and a number of Tories want something like an American-style healthcare system. You can find all sorts of stories online about US citizens going bankrupt, losing their homes, and facing all sorts of financial problems due to medical bills. One of the ways to avoid many problems is to have robust health insurance from a well-paying job, where you pay a huge premium and get close to full coverage. But even if you're playing by the rules, you can get caught out, as this man shows in this clip. Remember, this is what right-wing politicians want to replace the NHS with.
How can I help you?
So I think there's a mistake on the bill, but maybe you could help me out. We got a bill, and then we realized that you guys didn't have our insurance, so we sent you the insurance, and it looks like the bill went up.
It went up?
Yeah, the first bill we got without the insurance was $600, and then the second one was almost $1,300.
Okay. Yeah, so that the first invoice you received, that's a discount that you receive if you're uninsured. So you're not eligible for the discount since you are insured. And so the bill was $2,342.14. We billed your insurance. Your insurance only paid $1,078.85.
Can I go back to the discount without the insurance?
No, sir, you're insured, so you're not eligible for the discount.
If I go cancel my insurance, am I eligible for the discount?
No, sir, because we checked eligibility and you do have active coverage for data service.
Oh, I needed to cancel it before I got the service to get the discount.
You're only eligible for the discount if you're uninsured.
Okay, so I'll get cheaper health care if I'm uninsured.
If you're uninsured, you're eligible for the discount, correct?
Is this common? Like I pay for insurance and I end up paying more out of pocket because I pay for a premium? That's wild.
No, this is just a new law that passed or started 2024 AB 716, and the law is if you receive a discount if you're uninsured.
Okay.
So when we first send a invoice to the patient, we bill them as if they're uninsured. If you're insured, unfortunately, you're not eligible for the discount.
Okay, so just if I have the incentive straight here, if I want to pay less for medical care, I should cancel my insurance if my daughter needs life-saving medical care?
I'm not sure. I don't know, sir.
You
should cancel your insurance. I'm just letting you know that discount's only for patients who are uninsured.
Okay, that is special. That is a special law. So there's no way to put that discount onto an insured person. Only the uninsured people get that.
Correct.
So just to summarize what happened here, this guy, as was pointed out in the clip, you can read the text, he needed to take his daughter to hospital. They needed to use an ambulance, and of course you have to pay for the ambulance in the United States. Now, in some cases your insurance will cover that, but because so many people can't access health insurance, it seems some states like California are helping to cover that cost, because so many people can't, because either with their job they don't get sufficient health insurance, or in many cases people don't have health insurance at all. Remember, people are paying hundreds of dollars, even thousands of dollars per month for health insurance, depending on the coverage or the support they receive. This is insane. This is insane for us in Europe and the UK to hear these stories about having to pay for an ambulance ride or to pay for some sort of treatment in hospital that is generally covered. Now, as was pointed out here in the clip, if he can't cancel his insurance in order to benefit from this saving. So what happened was he received a bill. The health insurance provider or whatever believed that he didn't, or the hospital or whoever was providing the care thought he didn't have health insurance and gave him a discount, and then realized, oh, actually, you do have health insurance. Well, then we're removing this discount. Like, it's important that people who don't have health insurance get some sort of support, that they're not left on the street, or that they don't end up bankrupt or having to sell their homes or whatever. But at the same time, it's a messed up system. There are people in the United States who are losing their homes, who are going bankrupt, who are getting into massive debt in order to pay their medical bills. And in some cases, and in many cases, they're actually insured. It's just the insurance doesn't cover everything. You know, you could be going for a walk and get hit by a car. Not your fault in any way, but if your health insurance doesn't cover that, then you're going to have to pay it out. And in many cases, it's extremely expensive. So remember, this is what Nigel Farage and the likes of Nigel Farage want to copy in Britain. They think, look, the NHS is broken. The Tories ran it into the ground. It's not working. It's not fit for purpose. We need something better. They used to really want an American-style system, but now they're starting to realize, well, we can't have that, or we better not broadcast an American-style one, but we need to change it. We need to replace the NHS with something similar. Now, there are people within Reform UK who said, you know, we just have a two-tiered system. If you can pay, you pay. If you can't, well, then that's your fault. Why should people who have money, lots of money, have to compensate for people who don't? They don't believe in a society. They don't believe in a social safety net. They don't believe in the NHS. And they're, invited on TV all the time to run the NHS into the ground, to criticize it. Remember, the Conservatives decided we're not going to invest the resources necessary, be it money or people, in order to maintain a healthcare system. The envy of the world, it was. Now it's been run down constantly by politicians and commentators who want to see it replaced with something like this. And just think about it for a moment. When you get sick, you go to the hospital, you get treatment, you don't think about bills. It's paid for through the system, through your taxes, through national insurance. These are the things that are paying for the healthcare system. That's the way it should be, that everyone pays into it. Maybe you'll never need to use it, but it's always going to be there. But in America, you don't have that. If you have a well-paying job, you're going to have pretty good health insurance. Many people are afraid to quit their job because if they do, they'll lose their health insurance or lose part of it. So many people are doing jobs they don't like, scraping to get by just to have the health insurance because they're afraid that if they get sick, they'll have to pay out of pocket. This is a word of warning to people. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.